Miss,
Shall I start, sir?
yes, yes. Miss
Shall
Jenny,
I do?
22 years old, coming with the problem. Who is timing?
I'll do it.
Oh,
I'll do it. Sorry.
okay.
Hello, good evening, Miss Jani. I am Dr. Mrcgp. I am your GP today. How can I help you?
Good evening, doctor. Doctor, some thoughts are disturbing my mind these days. I thought I will be okay, but as it's continuing, I came to consult you.
Hello, Miss Jani. I am sorry to hear that, but don't worry, I can help you. Can you just, could you tell me more about your problem?
Yes, doctor, like last 6 months, I feel down and feeling like going out, and I feel sad. I'm unable to concentrate in anything. It's disturbing my day-to-day activities. That's why I have nobody to open up. So I thought maybe some medication will help me. That's why I came.
Actually, it's good that you are coming to Miss Jani, and I am going to ask some specific questions. Is that all right with you?
Yes, doctor.
And you are having some low mood and just some sadness, and other than that, any other thought problem you are having?
Yes, doctor, I feel less confidence. I think that I look ugly, so that makes me not to go out, and maybe that is one
Yeah,
disturbing me.
and you told me that you are you feels like you are ugly, and you are having some form of but how about your weight? And you are having some you feels like you are having more weight, or your figure is not uh, proper, like.
No, doctor, not about my weight. Weight is normal, and I checked
Yeah,
my also that is also normal. But
yeah.
when I see the mirror, I feel like my face is ugly. Because of that, I don't feel like going to the university. Not talk. No, I have less confidence talking to my friends. I always feel like my nose is not in good shape.
Yeah. Then anyway, I am asking some specific questions. Is that all right with you? And you feel any anxiety?
No, doctor, but I feel sad, not anxiety.
And how about your mood, your low mood, and you are having any with any activities not pleasurable. You have, if you are doing something, any hobby or any activity previously which were preferable, that pleasurable to you, but now not feel like that.
Yes, I'm a university student. I was very active
Yeah,
in studying. I joined university 1 year back, but
yeah.
last 6 months, I spend lots of time in front of the mirror, and whenever I see it, I feel my nose is deformed, and because of that, now like day by day, it seems like it's increasing. I'm unable to concentrate in my studies. My academic activities are falling down.
Okay. And Miss Jenny, have you ever thought of like harming yourself or harming others?
No, doctor.
Okay, good. And how about your sleep?
Sleep is little disturbed, I think, last few days. Sometimes I sleep during the
And
day.
how about your appetite? How
Appetite,
about your appetite?
not that
And your eating is as normal, no?
yes.
And do you have any headache? It's for 6 months, and before that you didn't have any problem, no?
No, doctor, no problem.
And anything, any other, just like you are having any feeling like the elated mode or high mode before this?
No, no.
And you feel like you are the somebody is inserted thought or took away your thoughts, like.
I didn't understand, doctor.
No, that you feel, have you ever feel like you are having some thoughts which somebody has inserted to your
No, no.
mind, like? Good, good. And you don't have any uh, fever, headache, or visual disturbances or anything, no?
No, doctor.
Okay, good. And just tell me, do you have any long-term illnesses?
No, doctor, nothing like that.
And you are not taking any treatment, no, at the moment? Any
No,
medicine?
nothing. I'm not taking anything.
And you just tell me about your menstrual history, your periods,
That is normal, doctor.
and you are 22 years old, female university student, and just tell me about your family and family background. You are staying with parents or in the university alone?
I'm staying in hostel for last 3 months. I'm
And
only child for my parents. I visit them every week.
and you are getting good support, and
Yes,
you are having good friends also.
I had friends, but now I am avoiding those friends. So they also call me and ask me to come for the parties or going out, but I avoid them.
Okay, okay. And other than that, I forgot to ask you, in your family, I am asking some personal questions just the sake of completeness. And Miss Jenny, don't get scared. Do you have in your family, within your close relatives, ever, which anyone of having any mind-related issues?
No such things, doctor. Do you think it's something with mental illness?
No, at the moment I am checking, but anyway, after this examination, I will tell you. Is that all right after this consultation?
Okay, doctor.
And other than that, actually, if I recap, you are Miss Jenny, 22 years old, the university student, came with a problem like 6 months of you are feeling some you are having some the low mood with some related to your feeling some abnormality with your body nose actually. And is there anything to add?
Yes, doctor. My other concern is that my academic activities are also disturbed. I'm not attending the lectures.
How long?
Like 4 months.
4 months. And your illness also already 6 months, no? And I would like to
8 minutes.
do a quick examination.
Okay.
Is that all right with you, Miss Jenny?
Yes, examination not necessary, doctor.
And actually, Miss Jenny, according to your history, it's like something like uh, body dysmorphic disorder. It's mainly related to your your mind. Actually, it's just what you feel like. And don't worry, there are the treatment modalities and supportive things are available. So I would like to explain those things, and in the end of this examination, anyway, I would like to do some questionnaire also after this that PHQ9 like. Then before that, I am going to explain everything about your management. Is that all right with you?
Yes, doctor.
And you can any stop me anytime and ask any question if you have. Okay.
Yes, doctor. Do you think that plastic surgery will help me correcting this deformity of?
No, no. No, it's not. It's not. It's not actually. I can see you that you don't have any problem with your figure. It's what you feels like because it's for 6 months. So have a cognitive behavioral therapy. Don't bother about these terms. But anyway, with that talk in therapy and some other groups also, because some clubs and some groups are there. So I would like to refer you there. It's not mainly with the medicines and some counseling. Okay. And at the meantime, you can I can help you with some other counseling also. And other than that, there are some medicines
10
also.
minutes.
Is there any tablets I can take to
That sertraline, there's a called this SSRI. Sertraline, we can start that like 50 milligram. Like we can start, but it will take to settle. It will take some time, Miss Jenny. And meantime, you better get that other counseling treatment. I can refer you. And meantime, if you get any thought of harming yourself or suicidal idea, you better come to me. I will share all the detail, my contact details also, and you can call me anytime.
Okay.
And meantime, I will give you some links to join some groups also. Is that all right with you?
Okay, fine, doctor. Thank you.
Okay, thanks for coming today.
Yes, thank you, both of you. No, yes, Dr. Managa, very good. Body dysmorphic disorder. Yeah. So we'll see how to approach this. Miss Jenny, 22 years old, a university student. Recently, for last 6 months, she feel that her nose is ugly. So even though others are telling that it's normal, because of that, she is avoiding the social events and lectures. So academically also deteriorating. She is very anxious about her appearance, and there are some features of depression as well. And sleep also disturbed. But there are no eating disorders or any substance abuse. What happened is she has met some cosmologist, dermatologist, and cosmetic people also to correct it. Now what she is expecting is to do some plastic surgery. And also you have to ask about the hallucination delusion, because any psychiatric history, we have to ask. How we have to ask? So, Miss Jenny, are you seeing any things, any figures or pictures actually when there is nothing? Are you hearing a sound when there is no actually the sound? So we have to ask that also. And the self-harm and suicidal idea. How we can ask, have you ever thought of harming yourself? Have you ever thought of ending your life? Then the past medical history, any past history of mental health illness, and any family history of mental health illness. So those are the things, the social history, menstrual history. So social history, the student, living in a hostel, no alcohol, no smoking, no illicit drugs. And psychologically, she is very depressed and anxious as well. So what is her idea is her nose is deformed, and she need a plastic surgery to correct it. The worrying thing is her academic performance are affected by this, and day by day it's deteriorating. She's spending much time in front of the mirror. So then the examination, actually they will say not necessary. If you have to request it, so if anything, you can go for a general examination, pulse, blood pressure, hello, BMI, those things. But actually she need a assessment of PHQ-9 and mental state examination as well. But that we have to go on next visit. Then you can explain, Miss Jenny, with your symptoms. What I feel is it's likely something called body dysmorphic disorder. Have you heard about this? No, doctor, I don't know anything about this. But don't worry about the medical term. I will explain you. It's a mental health illness, yeah, mental health condition. But the good news is it's a treatable, right? So, Miss Jenny, you are not alone. We are here to help you. With some therapies, even some medications, definitely you will feel better. So, Miss Jenny, I would like to explain the steps that we are going to plan this, how it is sound. Yes, doctor, it sounds good. Please explain. The first thing is actually you are not looking ugly. Actually, you are beautiful. You are thinking that your nose is ugly, but even everybody says it's not so. Actually, the thought is not real. All right. Actually, what we have to do is please do not look into a nose alone. Look your whole body, right? So the whole body is not ugly, it's beautiful. So please do not avoid any social functions or academic activities. Please engage as earlier. And also, there are some therapies available. There is something called cognitive behavior therapy. Have you heard about this? No, doctor. So actually, it's a kind of talk therapy that is the gold standard treatment for this. So I will refer you to the psychologist who is expert on this. Is that okay with you? Yes, doctor. If it is helpful, then I can go for that. And also, you have to advise that please do not check the mirror frequently. And we have to make another appointment to check PHQ-9 and the mental state examination. And we have to see that if it is a very severely affecting her, the symptoms are more severe, it is affecting her day-to-day activities and academic performance, then of course we have to consider starting a medication, that is SSRI. As you said, you can start sertraline or fluoxetine, right? Usually the SSRI are given in the morning because it has a side effect of insomnia. So that's why it's preferred to give the morning time. Then you can make a safety net that if you ever feel harming yourself or ending your life, please immediately contact us. We will give our personal and practice number and immediately come and meet me. And also make a follow-up visit to assess thoroughly about the PHQ-9. Then she is asking about the plastic surgery. So usually the surgery doesn't resolve the body dysmorphic disorder. Even after surgery, they will feel the so because it's not in the physical appearance, the problem in the mind. She need a mental health therapy. That's the ultimate gold standard treatment. Other than this, we have to discourage to go for a plastic surgery. Right. So this is about the body dysmorphic disorder. Anything you want to add? Anything?
Dr. Farahath, what are the differentials we have to take in this case?
Differential will be the body dysmorphic disorder, social anxiety, obsessive compulsive disorder, depression, even eating disorder. But eating disorder is not there. So other DDs are still possible, yeah. So,
Okay, thank you.
but clearly she says that her nose is deformed and I feel ugly. She is spending more time in front of the mirror. And also she has gone to some cosmetologist and also planning to meet a plastic surgeon to correct this. So all those histories are suggesting of this body dysmorphic disorder. And she is avoiding some social function, avoiding friends. So those are suggestive of social anxiety and frequently checking and uh, checking and frequent thoughts are kind of OCD. But when there is mental illness, all are little bit contributing, right? So that's why the treatment is one for everything. SSRI, even body dysmorphic disorder, social anxiety, OCD, depression, all the diseases are treated by the SSRI. Oh, this kind of disorder, but there are anxiolytics and antipsychotics, so that is different. These are mood disorders. Okay, shall we move on next case? I think Dr. Gauri is there. Dr. Gauri also doing exam in April. Dr. Gauri is available. If she is not available, then we'll give the chance to other April people. Who is ready?
Myself?
Dr. Homi.
Yes.
Right, good. So we have to leave and rejoin, no? Time will be enough. No, please everyone leave and rejoin.